everyone, so welcome you all to Ashok Tutorials Meghalaya's first attempted channel. So my dear friends, as you know that I have been teaching you health education of class 10, right? So in this video we are going to learn about Unit 5 of health education, which is about life skills education. So we are going to see what all we have in this unit, right? So let's start slowly. So alright, let me zoom it for you first of all so that you can see it clearly, right? Last time some of you were giving me the feedback that sir, it is not so clear, we are not able to see. So I have to make sure, right, that you are able to see it. So let's start. Unit 5 life skills education. So first of all we are going to see what is the introduction about life skills and educations we have. So let us see. Life skills education is meant to enhance capabilities of adolescents and young adults to help them deal with many challenges of life. So we know that we all are human beings, right? Especially the adolescents, the teenagers who are in their early life, or who are in their teenage, or who are at the age of from 13 to 19 years of age. They are very much tender, or they are very much fragile, because there are lots and lots of hormonal changes going on into their body, which impacts their physical well-being, mental well-being, emotional well-being, and social well-being altogether. All right, so we need to know how to manage, how are we going to maintain a balance between the physical development, emotional development, mental development, and what's the social development, right? So let me continue. So next we have young people hold the promise of our future, so it is important that they develop psychological competencies and interpersonal skills. So what does it say? That can help them solve problems, think creatively, think creatively, communicate effectively, and build healthy relationships with peer group and society in general. See, we know that India is a young country, or is a developing country. Why? Because the majority of the population of our country are young adults or young people. So that's why we say India is a young country. So we also know that young people are the future of our country, or students are the future of our country. Why? Because they are the ones who are going to contribute in the near future for the well-being and development of the country India, right? So we have to know how these people, how these young adults should maintain a balance between their interpersonal skills, between their communication skills, problem solving skills, critical thinking skills. All right, so they have to know how to maintain or channelize. It is through life skills education that young adults would be guided in making some key life events decisions, such as marriage. All right, see, why are we learning this particular chapter, life skills education, is because it will help us in the long run. And how it is going to help us in the long run? It is going to help us in the long run by providing providing us certain suggestions, certain advices regarding the marriage of the individual, regarding the employment, bearing children, and gaining acceptance in the community. So we all know that no man is an island, which means we cannot live in isolation, right? We are social beings. Human beings are social beings. Human beings are they live in families, they live in groups, right? No man lives alone. So now when we live in a community, we want our community or our society to accept us, right? We want our neighborhood, our neighbors to love us, to care for us, to talk to us, to visit us and help us in any kind of troubles, and to take part in sad events or happiness, or whenever there is any good things happening in the family. So we want them to connect with us, right? So that's why we have to behave in such a way that we are accepted in the community, we are accepted in the society. So there are certain things, which you have to deal with when dealing with through this life skills education. The young people will be able to avoid the risky situations, and they will be able to make a positive and fruitful choices. All right, let's go and see what we have next. So what are life skills? So class 10 students, in your mind, at the back of your mind, you might be having questions. So sir, please tell us, what do we mean by life skills, right? So we are going to learn about different type of life skills as we proceed further in this video. Let us see. The World Health Organization. So in the previous chapter you have studied about World Health Organization, right, class 10? So WHO. So the WHO defines life skills as the abilities for adaptive and positive behavior that enables individuals to deal effectively with the demands and challenges of everyday life, 1997. You have to remember this definition from your exam point of view, class 10. So what it says: abilities for adaptive and positive behavior that enables. So first of all, we need to have positive attitude, we need to have positive behavior, we should have the curiosity of learning, curiosity of adapting, and follow certain do's and don'ts of the society, right, where we are going to live, right, to deal effectively with demands and challenges of everyday life. And this will help us particularly in solving our problems, solving the challenges which we are going to see as we proceed with our lives. So these skills have been broadly classified into 5 areas. How many areas? 5 areas. So we are going to look at them one by one, right? Let's see. So first of all is self-awareness and empathy. See, first one is self-awareness and empathy. Now what do you understand by self-awareness? Self-awareness means you need to know your physical development, how you're developing physically. You need to know how you are, how much you are aware about your mental status, how well are you aware about your personality, about your attitude, about your behavior, about your social life, about your financial life, about your health issues. So those things, self-awareness means you have to know everything related to your life and which is happening in your life, and what are the consequences and effects you have because of those factors that you need to know. And empathy means to feel what the other feels. Suppose you pass in class 10 and your friend, he is not able to qualify. So in that situation, what will you do? You don't need to show sympathy. These are two different words. All right, sympathy means saying, oh, you did not pass, no problem, you will pass next time. That is sympathy. But empathy means you feel the pain of your friend. You try to put yourself in the shoes of your friend. You try to put your legs, your feet in the shoes of your friend. You wear their shoes and you feel their pain. As a saying goes that the wearer knows where the shoe bites, right? So the one who is in trouble, they will know where the shoe is biting, right? Then we have communication and interpersonal relationships. Now see, communication. This is a form of communication, right? But we have another form of communication. What is that? See, there are different forms of communication. The way I am talking to you right now, you're watching me on your mobile phone, right? Sleeping on the bed and you're watching me. So what is this? This is a form of communication, which means I want to share with you some information, some knowledge I have in my mind, and I feel like you should know that. That is a form of a way of communication, right? Then again, there is another way of communication, that is through telephone, through mobile phones. You communicate with your friends and your loved ones. Now, another form of communication, the best one, the most important one, to which we are ignoring these days, what is that? Talking face to face. talking face to face with your friends, with your mother, with your father, with your parents, with your brothers, sisters, siblings, teachers, elders, younger ones, right? So that is what, that is communication, talking, face to face talking. So in this present scenario, what will you see? You see everybody is using phone, right? They are busy in their phone. They are talking to you, but they don't look at you anymore, right? Suppose you go to your friend's house and you go there and your friend is sitting in the sofa and they ask you to sit, and the friend is busy scrolling reels and he's busy talking on phone. So will you like to visit your friend the next time? No, you will not like it. Why? Because he or she is not giving you importance. He or she is very busy scrolling his or her phone, right? So it is very, very irritating, and it is not social ethics. Social ethics means what? It is not socially acceptable. It is a very, very bad behavior, right? So when you are talking to somebody or when somebody is talking to you, try to look at their face. You also, when you talk with your friends, with anybody, please look at their face. Don't look at your mobile and talk. That is very, very rude. Understood, my dear class 10 students? So we don't talk anymore. There is a song, right? We don't talk anymore, right? That song is there, right? So you comment who is the singer of that song. So why don't we talk? Because we are too much involved in our mobile phones. So please avoid using mobile phones and try to talk to your loved ones by looking at their face and not looking at your mobile phones. All right. An interpersonal relationship. What is interpersonal relationship? Interpersonal relationship means, suppose in your class, class 10, you have got how many students? Suppose, for example, you have got 30 students. So out of that 30, if you talk with everyone, if you involve yourself, if everybody likes talking to you and you like talking with everybody, which means you have a very good interpersonal skills. But if you, out of that 30 students, if you stick only to one or two friends of yours, that means you don't have any interpersonal skills, which means you don't know how to talk to people, you don't know how to make friends, you don't know how to take care of others, and you don't know how to love people. So my dear students, don't just stick with 1, 2 or 3 friends. Don't make groups. In my college, we were not allowed to make any groups. Groupism is banned, which means you should not have only 2 or 3 friends. If in your class you have 50 students, you should talk with everybody, make friends with everybody. No need to always go in groups. Suppose let me not name, but suppose ABC is a group. So that ABC will always want to go with ABC. It will not want to go with Z. It will not want to go with M. It will not want to go with O, right? So don't be like that. If you are A, you make friendship with everybody. You make friendship with everybody, not only with ABC, all right? So that is, if you are having a very good interpersonal skills, then you will have many, many friends. And my dear friends and my dear students, I would like to say that I have a very good interpersonal skills, which means I love talking with everybody. And most of the time what I do is I do undertake journey, right? I'm traveling. Most of the time I'm traveling. So co-passengers are there. So maximum of my friends, in my contact list, if you see, maximum of my friends are from my co-passengers, like who was traveling with me once upon a time. So they are, maximum of them are my friends, which means I have good interpersonal skills, which means I talk to my friend, I just talk to that stranger who is sitting next to me in the bus or in the sumo or in the winger, right? So I don't mean that you also talk. It's up to you. It's up to your convenience, up to your likeness, and up to your how you take it. But according to me, and me personally, I love talking with everybody. Let's go to the next one now. Decision making and problem solving. See, decision making skill is very, very important, and problem solving skill is also very, very important, right? So suppose if you pass your class 10 and after that you are not sure, you're not able to decide whether to go to arts, commerce or science, that means you do not have a good decision making skill. That means you need to learn that, right? Because right after passing your metric examination you cannot wait anymore. Suppose if you are passing your metric examination today, then you know what, the forms are out today itself, so you don't have the time to think about like which one to choose, which one not to choose. That's why you need to make quick decisions. So you should have a good decision making skill and problem solving skills also. See, in your life you have friends, you have family members, you have teachers, you have your classmates. So you are going to have problems, different type of problems, relationship problems, money problem, health problem, then other types of problems. There are lots and lots of problems in our lives. So how are you going to tackle your problems if you do not have problem solving skill? It is not possible, right? So that's why you also need to learn how you are going to have or develop that problem solving skill within yourself, right? Let's go to the next one now. See here, some of the life skills are given. See, interpersonal skills, see, many friends, right? Yeah. Then strategic thinking, which means you know how to plan your life, how to plan your schedules, then leadership behavior, you know how to lead your friends, how to lead your team, how to lead your class, how to be the leader in march pass. So all those things right? Then empathy I've already explained. It means how you when your friend is sad, how you carry yourself. You don't need to sympathize, you just need to be empathetic to your friend. You should feel what he or she is feeling. That is called empathy. Then integrity means unity, right? Unity is strength, we know that. Then creativity. So your creativity is also a form of life skills, how creative you are. Now let's see number 4, creative thinking and critical thinking. So creative thinking means if I give you one apple, suppose there are 3 boys or 3 girls or 3 students in my class, and I give them one apple each, and I ask them to cut the apple creatively and design it and make it presentable in the bowl or the plate I have given you. So they are going to design in different ways, yes or no? They are going to design in different ways. So some might be very excellent in designing that, some might be very poor, some might be mediocre, right? So that is their creativity level, right? So this is what we know by creativity. And then critical thinking means you are able to think. Abstract thinking is developed in your mind. You are able to think about the things which don't exist or which exist, but it needs a lot of your logical thinking, logical understanding, reasoning abilities, that problem solving skills. So all these will come together in what? In critical thinking, right? Now coping with emotions and coping with stress. Coping with emotions and coping with stress, this is very, very important, my dear classmates, boys and girls. Why? See, coping with emotions. So those who are watching my video right now, you might be 14 years, 15 years, 16 years, 17 years, 18 years, 19 years, or maybe even 20 years, right? Those who are watching my video right now. So now you see, when we are teenagers means what? Teenagers means from 13 to 19. Why 13 to 19? 13 to 19 because see, 13, THIRTEE, and teen is there, word teen is there, right, in 13. Then again in 19 also NINE, 9, TEE, and teen is there, right? So that's why we call from age 13 to 19 as adolescents or as teenagers. And as mentioned by one of the psychologists, that is Stanley Hall, is the scientist who stated that adolescence is a period of stress and storm. which means when you are in your adolescence age, which means you are from 13 to 19 years of age, in between that you are going to undergo a lots and lots and lots of stress you have in your life, in your family, in your relationships, in your friend circle, in with the teachers, with the subjects, with the principal, with the schools, with the health. So a lot of issues are going to be there, right? So you will be very very emotional when you are in your teenage. So you might get angry very fast. Is it good or bad? It is bad, right, to get angry. Then you might get angry very fast, you might be sad very fast, you might be hurt very fast. Then you don't know how to control your angers, and you cry every time, you get angry every time, you are moody every time, you are short tempered. Then you feel jealous of your friends, you hate your friends, right? So all these are emotions, negative emotions. We have positive emotions, we have. So you need to know how to maintain a balance between your positive emotions and your negative emotions. Try to reduce your negative emotions as much as possible and try to increase your positive emotions as much as possible, right? Now you see stress. Stress means what? Stress means the thinking, the khichdi you have in your mind, right? Suppose, all right, let me give you a very simple example. Suppose tomorrow is mathematics test or science test and you have not studied anything. Why you did not study? Maybe there was certain problem in your family, so because of that you could not study. So now you have come home, but it is already 8 o'clock, so you don't know how to study. So many things will be going into your in and around your mind, right? Like you might be thinking, I will not go to school tomorrow, or you might think like I will come halfway, a half leave I will take and I'll come back. Or you might be thinking I will study in the morning, or you might be thinking I will not write the test, or you might be thinking I will study early morning tomorrow, or I will cheat, I will make a cheat, I will go to the examination and I will cheat. So many things, many stress will come into your mind, right? You'll be thinking about how to solve that problem, so you'll take stress. You will not like sleeping also, you'll not sleep well, you will not eat well, you are worried for tomorrow's test. And when you go to school tomorrow and you find that the teacher is absent, so how do you feel? You feel very happy. But do you think like it was worth of you getting stressed last night? Because last night you were worrying like anything, and now teacher is absent or the test is not conducted, then you are relaxed. But unnecessarily you have taken so much of stress last night, right? And when you take so much of stress, what happens? You get wrinkles on your skin, you get pimples on your skin, right? So what you have to do is that you have to smile always, and when you smile you get what? You get dimples, right? So all of you love dimples, right? Dimples here, right? So all of you love dimples, so keep smiling all the time, right? Don't be sad, don't frown, because when you are stressed, when you are sad, you get pimples more and more, right? All right. A person skilled in the above areas would have the following capabilities. See, now those who have those skills which we have talked about already, they will have what? Capabilities or capacities of the following: self-awareness, being aware of one's character, strength, weakness, desire, likes and dislikes. See, now if suppose I say, you, the one watching my video right now, you have very good social, you have very good life skills education. So how can I say that? So there are certain factors. Let's see. First of all, we have self-awareness. So if I ask you, all right, what name should I use? My name, Ashok. All right, Ashok, what are your strengths and weaknesses? If somebody asks me, if my teacher is asking me, so I should be able to tell him or her that my strengths are these: I'm very courageous, I am very brave, and what I fear about my fears, like what are the things I fear, then what are my desires, then what are the things I like to do, and what are the things I dislike, I don't like to do. So those things I should be able to tell, which means I know about myself. Suppose if I ask you right now, what is your favorite song, please comment in the comment section. So if you know, yes, this is my favorite song, and you're commenting in the comment section, which means you know something about yourself, your likes. And suppose if I say comment a vegetable which you don't like, so you're commenting there, I don't like bottle gourd, I don't like potato, or I don't like pumpkin. So that means you know that thing about yourself. Then suppose if I ask you, what are your desires, what do you want to become, what is your aim in life, you are able to tell me, I want to become doctor, engineer, teacher, lecturer, professor, then pilot. So if you are able to tell me, then it's great. Then strength. Suppose if I ask you, what are your strengths, you say my strength is my communication skills, my language skills. And what are your weaknesses? If you say my weaknesses are ill health, I often feel nervous, or I get sick easily. So those are your weaknesses. And so these are the things you should know about yourselves. All right, class 10. Now empathy I have already explained, I don't want to explain anymore. Then effective communication skills, be able to express one's desire, fears, and opinion effectively, seek assistance and advice when needed. Now you see, many of you might have taken part in extempore speech, in debate competition, in quiz competition. Have you? Yes, you have taken, right? So basically, if we talk about extempore speech, so in extempore speech, what happens? You go to the stage and you pick up the chit. Suppose if you get global warming, so you will get 3 minutes to give a speech on global warming, and this speech is not going to be pre-planned or prepared. You do not know the topic, it is a surprise. So suddenly you will get one topic and you have to speak on it. So you stand there, take the paper, see, oh, it's global warming. Then you give the introduction of what is global warming, then what are the impacts of global warming, how can we stop global warming. So those things you say and you do, right? So that is what that develops your communication skills. You get fluency, you don't feel nervous anymore, you don't have stage fear anymore, you know how to stand on the stage and talk in public. You are very good at public speaking, you know how to make use of your hand gestures, of your body language, of your verbal language, right? So those are the factors you will have when you have effective communication skills, right? Then strong interpersonal relationship, understand what builds and breaks a relationship, relate positively with people, maintain an end relationship in a constructive manner. Now you see, you should know how to make bonding with your friends, with your classmates, with your teachers, with your parents, with your siblings, with your seniors, and with your juniors, right? So you should know how to maintain good relationship with one another. You should know when to stay and when to leave, right? When to make a relationship and when to break a relationship, you should know that, right? Now, decision making, I have already explained all this. Problem solving, I have explained. Creative thinking, I have explained. So why to waste time, right? Then coping with emotions, explained already. Then coping with stress, also explained already. Now let us see this do you know. There are certain do you knows. Number 1, teenage pregnancy could often lead to ill health of both the mother and the child. Teenage pregnancy could often lead to ill health of both the mother and the child. Now, what do you understand by teenage pregnancy? Teenage pregnancy means when a girl becomes pregnant when she is between the age 13 to 19, right? And you know that it is illegal for a girl to get married until she is 18 years of age, right? If she is 17 years and she is getting married, that is illegal, right? Now, it says that teenage pregnancy means what? Suppose a girl is 13 years or 14 years or 15 years or 19 years and she is getting pregnant, that is called teenage pregnancy. And teenage pregnancy is very bad, very bad, right? It is very bad for the society, for the individual, for the family, for the community, for the neighborhood, and for everyone in and around, right? You know, when a girl, she is a teenager and she is pregnant, it is going to affect the girl, the mother, and her baby or the child as well, because you know, the mother herself is just a teenager, and how is she going to take care of a baby, right? So she herself is a baby and how she is going to take care of another baby, right? So it affects the health of the mother, and it's a very bad thing, right? So you should avoid teenage pregnancy. Let's see another one now. Teenage pregnancy also results in the young mother abandoning education halfway. This is very sad. Why it is sad? See, suppose a girl studying in class 10 or class 9, she becomes pregnant. Then it's a very sad thing. She will discontinue her education. Now there might be different factors why she will not come to school, why she will stay away from school, why she will leave her education. But one of the main reason is the tummy of the mother, right? So the girl who is studying in class 10, and if she happens to get pregnant, then one day or the other her tummy or abdomen is going to swell, right? So the baby bump will come, right? So that is where she will feel shy from her friends, from her teachers, and she will stop coming to school, and you know, she will just spoil her life, because that was the time for her to study in class 9, 10, 8, 7. But what happened? She is pregnant, which means it is the end of her future, right? Not only the end of her future, even the baby she is going to, you know, deliver, even his or her life will be affected negatively. So my dear students, please don't be victims of teenage pregnancy. Especially I'm talking to girl students, and also I'm talking to boy students, right? So both of you, the boys and the girls, you have to be very careful, because even to the boys I would like to request, when you make a female pregnant, you are spoiling her life, and at the same time you are also spoiling your life, because you never know, it might affect your life also negatively, because you will have to marry that girl, right? You cannot just leave her like that. You need to marry her, and when you marry her, it's her life is spoiled, your life is spoiled, and the baby's life is also spoiled. So this is very dangerous. So don't practice that, my dear boys and girls of class 10. Whoever is watching my video right now, please don't do that. When you are of that age, when you should do it, you do it. When you are 18 years, 19 years, 20 years, 21 years, get married, settle down, have your family, and do whatever you like to do. But when you are in schools, please avoid it, right? Now another point, an infection could often be dormant in a carrier's body without any visible symptoms, but it could be transmitted to others. Now you see, HIV/AIDS, all of you know, right? HIV means what? Human immunodeficiency virus. What is HIV? Human immunodeficiency virus. And what is AIDS? Acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome. So HIV/AIDS means human immunodeficiency virus, acquired immunodeficiency syndrome. So you know, AIDS is a problem. So you never know that you are suffering from HIV/AIDS up to 10 years. Suppose now it is 2024, right? Suppose if somebody has, you know, infected with HIV/AIDS in 2014, that person will not be aware that he is suffering until 2024. So it takes time to develop. But the HIV/AIDS virus are always transmitted from one person to another during different type of activities, like use of syringes, transfusion of blood, sexual activities, right? So there can be different reasons, right? Blood cuts. Now let's see, a disease is manifestation of the infection, right? Then number 5, HIV is an infection which attacks the body of immune system and weakens the body's defense system. All right, now what is HIV? HIV is a virus, right? HIV is a virus which affects what? It affects your immune system. It affects your WBC, it affects your white blood corpuscles, white blood cells, right, which have the antibodies which fight against the foreign invaders, the microorganisms, the bacteria, the viruses, right? So our body have its own defense mechanism, our own soldiers we have, right? So these soldiers, they fight against the bacteria and the viruses. But when you are infected with HIV/AIDS, your immune system or your security guards, they die. They are not able to help your body. So suppose if an HIV infected person gets cut in his or her hand, the bleeding will never stop. If that person is suffering from malaria, then he or she will never be cured, because you have no more immunity in your body. Now see, now my dear students, when you get cough and cold, when you have runny nose, when you have tooth pain or whatever simple small problems, or maybe fever also, what happens? Today you are suffering, tomorrow you are fine, right? Or day after tomorrow you are fine, or if not, by 5 days, 3 days you are fine. But when you are infected with HIV/AIDS, you will never be fine. You have to take medicines. But let me remind you, let me correct you, let me warn you, that is, there is no medicine for HIV/AIDS, which means if somebody is infected with HIV/AIDS, today or tomorrow he is going to die definitely. He or she is definitely going to die, just like cancer. Cancer also has got no treatment, right? Chemotherapy, you know what is chemotherapy. Chemotherapy will only keep a person survive, can make a person survive for few months or few days. It is not a permanent solution. Likewise, even in HIV, there might be some medicines which you can take and you can survive for few days, but the end of the day, that person is going to die, right? Have to die only, no choice. Now, AIDS refers to a set of symptoms and illnesses that occurs at the very final stage of HIV infection. See, you or anybody gets HIV only when HIV infection has gone to different stages. See, in cancer also we have different stages, right? Stage 1, stage 2, stage 3, stage 4. So in HIV also we have different type of stages. If you think 6, then 7. If you think you have been at risk of HIV, testing regularly for HIV is the only way to know have this virus. Now you see, if you doubt yourself, if you think you have many sexual partners, if you think you might have been infected with razors or blade, anything, if you think you are a drug addict and you are taking syringes, right? Or if you think you have taken blood of somebody, not sucking the blood, of course taking the blood when you are in need. So if you think that person's blood, you might have been infected with HIV, that person was infected with HIV, so you might also have a chance or tendency of getting infected with that. In that case, you should go to the hospital and do HIV testing, right? So that's why you will see in many situations what happens. Suppose you need blood and your friend is coming to give you blood, so your friend's blood will be tested for HIV first before giving your friend's blood to you. Why? So that his HIV viruses are not transmitted to your body, so that you are not infected. So anybody in this world, when they are going to donate blood, their HIV test is done, right? There is no cure for HIV and AIDS yet, but treatment can control HIV and enable people to live a long life. See, this is what I already told you. There is no cure for HIV/AIDS. Only thing you can do is you can extend your life. Suppose if somebody is going to die on the 30th of June, then that person can extend his life up to 5 or 6 of July, like that, right? Just an example. So I think now let us continue with chapter 1, that is teenage pregnancy. So what is teenage pregnancy? So as I have been telling you on and on, that teenage pregnancy means the pregnancy of the girls who are at the age of 13 to 19 years, right? So those girls who belong to 13 years, 14 years, 15 years, 16 years, 17 years, 18 years, 19 years, they are known as teenage. And the pregnancy of those women are called the teenage pregnancy. So teenage pregnancy is actually, illegal, right? It is not legal, so it is kind of illegal, right? So let's see, what do we understand by that? See, actually I cannot say that it is illegal, of course, when we know that the legal age for women is um, 18 years, right? The age to get married for women starts from 18 years, and for boys it is, for men it is 21 years. So it is not illegal when you are 18 years, 19 years, but of course there are problems which are associated with teenage. So we shall discuss those problems now, right? Let us see. So right, so teenage pregnancy, also known as adolescence pregnancy, is one that takes place from puberty to the age of 19 years. Now what happens when somebody is pregnant at teenage? So teenage pregnancy is also known as adolescence pregnancy. What is that? Adolescence pregnancy. All right, and it takes from the start of puberty till the age of 19, so as I told you, right? So puberty is the period during which adolescents reach sexual maturity and become capable of reproduction. So puberty is the period. Puberty means it is a period in which the individuals become sexually mature, which means they are capable of reproduction. Now what is reproduction? So reproduction means producing the young ones of the same type, right? Which means giving birth to the offspring or giving birth to the babies. That is called reproduction. When there is a fusion between the male and female gametes, it results into the formation of a zygote, which as a result develops into a small young baby, right? All right, now let us see. It is marked with the beginning of the menstrual cycle in females, which is indicated by the commencement of periods. All right, now what is menstrual cycle? So all of you know that the female, they undergo menstrual cycle, which is of 28 days, right? Menstrual cycle of 28 days, which we generally called as periods, right? So when a girl starts having periods, or when a girl menstruates, that is the time when that is the time when she is sexually mature. Now, however, a young woman can become pregnant even before her first period. See, this line is very, very important. A young woman, she can become pregnant even before her first period. So this is what you need to remember. This is because ovulation, the release of an egg from the ovary, may occur before the first period. So now you see, we all know that in females we have the ovaries, and these ovaries are responsible for releasing the egg, right? They release the egg. And in males we have the testes, and these testes are responsible for releasing what? They are responsible for releasing the sperms, right? Sperm cells. So the testes, they release the sperm cells in males, and the ovaries, they release the ova or the egg in females, right? Now, in the absence of adequate contraception, the egg can become fertilized. All right. See, contraception I have already taught you, right? The best contraceptive example is the condom, right? So what happens is that, suppose if the couples are engaged in sexual activity and they are not making use of any type of contraceptives, then what can happen is that they can unwantingly be pregnant. The girl can become pregnant even if she don't desire to, right? So that's why the use of contraception is very, very important, right? Now the egg can become fertilized. All right, so what is fertilization? Fertilization is a process in which the egg is, egg unites with the sperm cell. So egg cell unites with the sperm cell, resulting in fertilization. So fertilization means the fusion of male gametes and the female gametes, right? Now, this phenomenon is quite common in teenagers, as most of them do not use any birth control measures like condoms, even when they have sexual intercourse. See, now what does it say? It says that teenage pregnancy is very common among teenagers. So where do we find teenagers? We find teenagers in class 6, 7, 8, 9, 10, 11, 12, right? So there we find whom? We find teenagers. So it says that the teenage pregnancy is very common in teenagers. So why? Because the teenagers, they don't use any contraceptives, they don't use condoms, they don't use copper T, so they are not using any type of contraceptive measures to avoid pregnancy when they are having what? When they are having sexual intercourse. All right, so you have to remember that. So that's why these contraceptives are very important for you to understand how to use it, when to use it, why to use it. You need to understand that. So that's why these contraceptives can prevent you from spoiling your life. So if you are making use of the contraceptives like copper T or condoms, then you might not have problem in the long run. So let's see now what we have. For a woman, including a teenager, to conceive, it is not necessary that actual penetration takes place. This is because sperm can travel upward from external genital area and result in pregnancy. It is therefore very important for teenagers to have proper knowledge and understanding of their body and its functions before they become sexually active. Responsible sexual behavior prevents pregnancy. See, now what does it say? It says that for a woman or even for a teenage girl, it is not necessary that they should have sexual intercourse. All right, it is not necessary. Why it is not necessary? Because I hope that you all have watched the movie called 3 Idiots. Have you watched it? Yes, you did, right? So in the movie 3 Idiots, you will see that the sperm cells, they swim, right? They are swimming like this, they swim and they go. So millions and millions of sperm cells are produced, even in just a small drop of in a needle. If you take, that has got millions and millions of sperm cells. And a sperm cell look like what? It looks like a tadpole, right? It looks like a tadpole. It has got a tail, right? It has got a tail also, so it can swim, it can move. So what happens is that even when somebody is not having sexual intercourse, the sperm, if it comes in contact with the genital of female, it can swim and go and penetrate itself inside the ovary and can connect with the egg or the ova, and hence it can make it fertilize, and as a result the zygote formation can take place, right? So that's why it is very important for the young people, for the teenagers, to understand the function of their body. They should know the function, right? Now, whether the pregnancy takes place after marriage or after sex between unmarried teenagers, there are several issues concerning the higher rates of nutritional and obstetric problems associated with adolescence pregnancy. See, now there can be 2 conditions for pregnancy. One can be before marriage, another one can be after marriage. So there are 2 conditions of pregnancy. One is before marriage, another one is after marriage. So what happens is that there are problems related to the nutrition of the baby. So what happens is that the mother is not able to provide enough nutrients to the developing embryo. All right. Also, ignorance and immaturity can result in higher morbidity and mortality among mother and baby. See, even when the mother is not well aware about her body functioning, then it can affect both the mother and the baby, and it can even cause the death of the baby or the death of the mother or the death of both, right? When you are not aware of your body's function, then anything can happen, right? Now let's go down and see, battery is not enough now, we have to make it quick. So the pregnant teen mother and the child born are likely to suffer from health, social, emotional, and economic problems. See, now the pregnant mother can suffer from emotional problem, from social problem, from health problem, from economic problem. So that there can be a lot and lots of problem when somebody is pregnant at teenage. Symptoms of pregnancy. The symptoms of teenage pregnancy are not different from normal pregnancy. They include, see, the symptoms of pregnancy is not different from those after marriage and before marriage, or those somebody is 25 years she is pregnant and somebody is 15 years she is pregnant, so symptoms are same, right? It's not going to be different. So let us see now what are the symptoms. I'll read quickly. Missed periods, which means they might not have regular menstruation or they might not have regular periods. Then fatigue, which means the pregnant mother will feel lazy most of the time. She will have fatigue. She will feel nausea or vomiting, sensation of vomiting. Then breast enlargement and breast tenderness. The mother's breast will be enlarged. It will swell. It will increase in size, and what? It will be very, very soft, right? Then we have irregular vaginal spotting or bleeding. Also, during the periods, what happens? There might be irregular vaginal spotting or even bleeding at times, right? The stomach cramping. They might also have stomach pain or cramping in the stomach. Increased drowsiness and moodiness. And what happens? Drowsiness, she might feel drowsy and she might feel sleepy and she might feel mood swings also she might have. All right. In spite of experiencing these symptoms, many teenagers do not tell anyone, and these symptoms may often go unnoticed by friends and families. All right. See, when you are being a teenager and you have experienced or you have involved yourself with sexual activities, then you should, and if you are having this kind of symptoms, then you should make sure that you are you are fine. If you are having any of these symptoms and you have indulged yourself in sexual activity, then it's better you go and visit a gynecologist or a doctor, right? Then, unfortunately, the teenager with irregular periods may not even realize that she is pregnant until she is well into the 5th month of pregnancy, when she starts feeling the baby's movement. See, now what happens? Many girls, they don't even know that they are pregnant until and unless they start to feel the movement of the baby right into their uterus. So now, teen pregnancy diagnosis. So how are we going to diagnose if somebody is pregnant? How do we know? So any teenage girl who experiences irregularity or absence of periods or any of the symptoms is advised to undergo a pregnancy test. So any female who have involved herself into sexual activity and have had unprotected sex without any contraceptives, then, and if she feel any of the above symptoms, then she should go and meet the doctor. If she is having irregular periods, then she should go and meet the doctor. An early diagnosis of pregnancy helps the teenager to adjust to it emotionally and physically. All right, adjust to it emotionally and physically. All right, early prenatal care is essential as well. So early detection of the pregnancy is vital. See, now when a mother knows that she is pregnant, then it helps both the mother and the child, right? It will help the mother to be physically fit, to be emotionally balanced, and at the same time it will help the mother to take care of the baby in a better way. Usually pregnancy is associated with weight gain, but if nausea and vomiting are significant, there could be weight loss as well. See, usually when somebody is pregnant, she will have weight gain, she will increase her weight, but it can also go other ways if the mother is experiencing nausea or she's having repeated vomiting or puking. Then, teen pregnancy cause and factors. See, what is the cause? Why teenage pregnancy is caused? You might be thinking that, right? So the ultimate cause of teenage pregnancy is unprotected intercourse. So this is what I already told you. So when you are having sex with your partner and you are not using any types of condoms, you are not using any types of copper T, and you are having unprotected sex, that time when your sperm goes into the vaginal passage of your partner, that time what happens? The sperm will travel into the ovary or into the uterus, and it will fertilize the egg which is there which is released by the ovary, right? A sexually active teenager who does not use contraceptive has 90% chance of becoming pregnant within 1 year. Potential behavior patterns for a teenager pregnancy includes see now, what does it say? It says that if somebody is sexually active, then she has 90% of chance of becoming pregnant within 1 year. Alright, now let us see what are the causes or potential behavior patterns for a teenage pregnancy. Why teenage pregnancy happens? Let us see. Early dating behavior. Early dating behavior means what? We see a lot of students starting from class 6. They are involved in relationships. They have boyfriends and girlfriends, right? They go to meet them, they go to party, they go, in and around, hang out here and there, they go for dating one another. So, and they do not have any kind of knowledge about their body, about the functions of their body organs, and they do not have any knowledge about the society. They don't have any understanding of how it happens. So that's why they have to be very, very careful. Students from class 6 to class 12, those who are especially teenagers, they end up doing this kind of mistakes. So my dear students, those who are watching me right now, please don't spoil your life, don't spoil your family's life, don't spoil your younger brothers and sisters' life, and don't spoil your friends' life, and don't spoil your future. All right, this message is to both the boys and girls. Please don't spoil your life, right? Then high risk behavior: smoking, alcohol, and substance abuse. See, many students these days, what do we see? They are into chewing shikar, vimal, elaichi, signature, cigarette, bidi, alcohol, breezer, then beer, and drugs, right? So these are the things the youngsters this day they consume. But my dear students, remember, the end of all this bad habit is death. So sooner or later, the person who consumes all this, they are going to die, and that too premature death, which means they will not die natural death. They will die because of cancer, or because of liver cirrhosis, or because of any kind of diseases. All right. Lack of support group or friends. Now, if you don't have good friends, if you don't have friends who motivate you to live your life happily, to live your life in a moral way, then also you become prey to this kind of activities. So you should choose your friends very, very wisely. Unhealthy environment at home, and also if your parents are not taking care of you nicely, if you have problems at home, or if they are ill-treating you, that time also this kind of things may happen. All right. Stress and depression. Suppose you are suffering from stress, or you're having any type of depression, mental problem, or you are not healthy, so that time also these things can happen. Then delinquency or criminal behavior. So if somebody is having criminal type of behavior, then also it might happen. Then living in a community where early childbearing is common and viewed as the norm rather than as a cause for concern. Now see, if you are living in a place where early childhood, you will see the young mothers, 14 years she already have a baby, 15 years she already have a baby, 16 years she already have a baby. So you see all your friends are getting babies, right? So you also want to have babies, and this is quite normal in your society. So this is also one of the factor if these things happen. All right, but this is not good. Again, exposure to domestic or sexual violence. So those who are exposed to domestic violence, they also might fall prey to this. Then financial constraints, even the money problem can lead to this kind of situation. Health and social effects of teen pregnancy in India. Single motherhood is associated with the causes mentioned earlier, and it can be overwhelming when an infant is born prematurely. See, you know who a single mother is? A single mother is somebody who is taking care of the child all alone. The father is not there. Either the father has died, or the father has just escaped or left the mother all alone. And she will have more problem when the baby born out of her is not normal. If an abnormal baby is born, that time the mother will have more problem. Then what type of problem she might have? She might have financial problem, emotional problem, medical health problems. All right. too difficult for a teenage mother and her extended family to deal with it, and it is very difficult for the mother because she herself is a child, right? It is further complicated with society's attitude towards teenage unwed mothers. So even the society will not look at you in a respectful manner. They will look at you like, this is the one, this is the criminal, or this is the one who has done this. So they will not have good thinking about you. They will have bad thoughts about you. They will look down upon you. They will neglect you, and they will discard you, or they will just throw you out of the society. They will not talk to you also, right? So you will have very much of pain in your heart. Then you might have suicidal thoughts, or you might have different kind of problems, stress, depression, right? So you have to be very, very careful. They can experience isolation and guilt accompanied by stress, depression. See, whatever I told you might result in lack of interest in studies. So those type of mothers, they will not even want to study. They will not even have interest to do job, and they will lack support from the friends because they will not have friends also, right? Because the mother and father of her friends will say, don't make boyfriends, don't date anybody, otherwise you will also become like her, you will also become pregnant like her one day. So these are the things our parents tell to us, right? So it is true. So choose your friends wisely, right? Now, health-wise, teenage mothers have a much higher risk of anemia, pregnancy-induced hypertension, low genital tract infections, which may lead to premature labor and delivery, requirement of a cesarean section because of prematurity, gestation of a large baby within a small pelvis, fetal distress, and sudden infant death syndrome. See, lots and lots and lots of problems are mentioned here, which means suppose if you are a teenage mother, you might have this kind of problems. You might give birth to a premature baby, then you might have some hypertension problem, then you might have anemia problem, which means the RBC is not enough in your body. Then you might have to undergo a cesarean section of cutting the tummy and bringing out the baby. Why? Because the pelvis region is not matured in your body till now, because you yourself is a teenager, right? So you are not, your pelvis is not fully developed to accommodate the child, right? So these kind of things, problems might also arise. All right, then the major complication in younger mother are thought to be high BP. See, the mother will have high blood pressure, iron deficiency, as I said, cephalopelvic disproportion when a baby's head or a body is too large to fit mother's pelvis. See, this is what I said. If the size of the baby is more and the space inside the mother's womb is less, then also the problem might arise. Then the birth of underweight babies. Similarly, infants born to teenage mothers are at a higher risk of complications and premature birth, low weight, accidental trauma and poisoning, acute infections and developmental delays. So the child born out of teenagers, they will also have different type of problems, the health related problems, prematurity, trauma, accidental traumas and poisoning. Different type of cases might be there, right? So it's a problematic one. Prevention and care. So how are we going to prevent teenage pregnancy, and how are we going to take care of it? Let us see. Pregnancy at a very young age, especially an unwanted one, leads to severe emotional and mental trauma for the girl. See, now if you have involved yourself into sexual activity and accidentally you become pregnant, then this becomes a problem for the girl, right? She gets into stress and eventually she gets into depression. What to do? How to tell to my family members, how to tell to my teachers, how to tell to my friends that I'm pregnant? This becomes a very, very serious issue, right? And this is not going to be the problem only for the girl, but also for the boy, right? Hence, the first and the foremost line of defense while dealing with this issue is informative programs that are effective in delaying attempts at sexual intercourse. Now you see, when you are in schools, you don't have to involve yourself into sexual activities, right? Parents, schools and healthcare professionals can have open, honest and educational conversation with teenagers and preteens. They can also provide advice to teenagers about how to prevent unwanted teenage pregnancy. See, now the parents can play a role, the school can play a role, the healthcare, the general public, the awareness, the friends, everybody can play a role in educating the ignorant one about how can we prevent the unwanted pregnancy, right? We all can play a role by educating the young ones. We should tell them how to avoid it, how to not to practice that, when is the right time to practice that, when should be avoided, when should we should not practice all this. So we should guide them what are the problems which will come into her or his way when one is pregnant. So all those pros and cons we need to tell them, right? Since unprotected sex is the main cause of teenage pregnancies, contraceptive counseling is extremely important in order to prevent them, especially repeat ones. Clinics, private medical offices, or NGOs can play a major role in providing counseling. See, now you can even visit hospitals and you can inquire, ask from them, like, how can I take care of myself, or how can I avoid the teenage pregnancies? Then you can make use of contraceptives. So we have already discussed about the different type of contraceptives, like the condoms for male, then the cooperative for females, eye pills, different type of medications, right? Then who can play major role? NGOs can play major role, then medical health officers can play important role, and clinics can play an important role by spreading awareness, by organizing different type of programs. Birth control pills, the most popular form of contraceptive for teenagers, should be taken regularly as advised, or else teenagers are at the risk of pregnancy. So birth control pills can also be taken. Now, on the other hand, barrier methods such as condoms, diaphragms, and foam have high failure rates among teenagers. This is due to sporadic and improper use. See, now many people, they use the barrier method, like they will use the condoms, they will use the diaphragms, but they do not know how to properly use it, so accidentally they can become pregnant, right? This is due to sporadic improper use. They don't know how to make use of it. To avoid pregnancy in the event of unprotected sexual intercourse, teenagers should be made aware of emergency contraception. See, suppose if somebody have had the sexual activity and this she considers or he considers itself as an accident, then they should in emergency take some type of contraceptive which is authentic and which she can rely on, and she can just visit the clinic or she can visit the medical experts and ask for the help. Though all these type of teenage girls avoid getting pregnant even after having sex, the best way, however, is to educate them about importance of abstinence or having safe sex. Now see, though all these help teenage girls avoid getting pregnant even after having sex. See, now these contraceptive methods, barrier methods, then using birth control pills can help the girls in not getting pregnant, right? It will help them. But the best part is you can have sex, but we need to educate the students. We need to educate them how, why, how it is going to affect your life, how it is going to affect your family life, how it is going to affect your social life, how it is going to affect your education, how it is going to affect your financial status, and how it is going to spoil your life in the longer run. So everything we need to educate, we need to inform to the girls and boys. All right, now let's see what we have. Think it over. So teenage mothers have a higher prenatal risk during childbearing. Not only for this reason, but also for reason of fertility limitations, teenage pregnancies should be discouraged as more years are available for more pregnancies. In young women, subsequent pregnancies should be discouraged as repeat pregnancy in young mothers increases prenatal risk. For the benefit of their family and themselves, teenage girls should display responsible sexual behaviors and abstain from sex as well as possible. Now see, if a teenage mothers, they have higher risk of prenatal death or higher prenatal risk during childbearing, which means when a teenage girl is going to deliver a child, there is a high chance that the child will die, right? The child will die. So you have to be very, very careful, and don't, like, suppose if somebody is 15 years, so this year she had a baby, then again next year she had a baby, then again next year don't do that. All right, you should maintain some gap, at least 3 years of gaps you should maintain between your child, right? Among your children, you should maintain that. So now the main role can be played here by the girls, our dear girls, our students, our teenagers. So I request you and I urge you, my dear girls, those who are watching me right now, whatever class you are, if you are a teenager, please avoid all these kind of sexual activities. Right, try to avoid this kind of sexual activities, and also discourage yourself from displaying or from involving yourself into sexual behaviors. All right, for the benefit of the family and themselves, teenage girls should display responsible sexual behaviors. All right, so here it says that you should display responsible sexual behavior, because it is not only you, your life, your family's life, your mother's life, your brother's life, your father's life, your social life, your neighbor's life, everything, your school life, everything will be affected in the long run, right? So my dear girls, please be safe, take care of yourself, and there is time for everything. So please wait for your time, your perfect time. So first of all, you need to study. After studying, you need to do job. Then you need to maintain your bank balance. Then only when you feel you're ready for the marriage, then please go and get married and have a grand wedding celebration, right? So I wish you all the best, my dear boys and girls. So I hope that through this chapter I was able to explain or educate you regarding the do's and don'ts about teenage pregnancies. So I hope at least something or the other you have understood by watching this video. So if you found this video informative, please don't forget to share this video with your friends, because your one share might protect the life of your friend who might have suicidal thoughts, who might be going into depression. So anything can happen. So sharing will not take time. Just share with your friends and your loved ones. All right, then like the video, show that this particular video is shown to different people who are in need. They might also come in contact with this video. Then again, you don't forget to subscribe to my channel Ashok Tutorials, because we are always bringing this type of informative videos for you. What contents we have, I don't want to mention again and again. So my dear students, my dear friends, so please take care of yourself, take care of your family members, your friends, your relatives, and your teachers and everybody in and around. Take care of your loved ones, especially take care of yourself. Right, so this is all in this video. So thank you everyone for staying connected with the Ashok Tutorials, Meghalaya's first AMTED channel. Thank you.